Mental health is taboo in our society. We don't talk about it.
I would say around 5 to 10% of this country's population definitely has a severe mental disorder. Official number of psychiatrists per 1 lakh population is 0.75. That's less than one psychiatrist for 1 lakh of the Indian population. Clearly, there is a very, very wide gap. We have patients coming to our clinic where they get derailed by a change in the color of your curtain.
All of our behaviors are actually can be traced back to the physical structure of our brain.
It's so covert in our country and it is so unacknowledged. We will blame everything else from the alignment of the stars to a bad breakfast in the morning before coming to the topic of mental health.
Hello, friends. Welcome to yet another episode of Bcubed Season 2. And this time, we are bringing to you a very special guest, a young, bright young spark, Dr. Trisha Gupta. She's a gold medalist psychiatrist presently working at the famous GB Pant Hospital. She's done her MBBS from Safdarjung Hospital and VMMC. Later, she's also done her master's from Ram Manohar Lohia Hospital. She is now qualifying to become a member of the Royal College of Psychiatry and is soon to be an SAS fellow at the NHS. More interestingly, she, in her spare time, she works around content. She creates content to, which comes on the intersection of mental health and socio-cultural issues on her social media Instagram page. And the point is that she has a very, very keen focus on social psychiatry, very relevant. Psychotherapy, women's mental issues, and importantly now, queer alternative practice. So, welcome to the show, Dr. Trisha. Lovely to have you here with us on Breaking Boundaries with Sabeer Bhatia. And this is one boundary that Sabeer Bhatia would like to really break because, mental health is so taboo in our society. We don't talk about it enough. What to talk of taking note of it and addressing it, we don't even talk about it. Mental health issues are very pertinent in society now. How many people, I wonder, are really fully mentally healthy? Dr. Trisha.
Well, the question is, what do you mean by mentally healthy? What is normal when you talk about mental health? Is it just in terms of productivity as a metric? Is it holistic health? Is it joy, perhaps? If we're going to fall under this rubric and use these terms, then I don't think any one of us is very mentally healthy. But of course, if we go by the diagnostic model of things, then I would say around 5 to 10% of this country's population definitely has a severe mental disorder. The rest fall in a spectrum.
I see. Okay, so how do you define mental health exactly? I mean, definition. I mean, on the average, if a society is mentally more healthy than another society, what would be the parameters?
There's a biological perspective to it as well as a psychosocial perspective to it. Biologically, I think the definition of mental health and health cohabit, where if you're physically healthy, if your mind is functioning at the capacity it's supposed to, if you can attend to your surroundings, to your day-to-day life well, then you are maybe biologically healthy. You're performing well as an individual of the society. In terms of psychosocial mental health, if within the cultural confines that you live in, you are able to live a productive life, live a happy life, have relationships that are meaningful and fruitful to you, I think all in all that would encompass mental health.
I have a simpler definition,
Please,
if I may add,
I was coming to you.
of mental health. And that is, I like to solve problems with first principles. Mental health comes from how you think, how you feel, and how you behave. And if those three things are in order of what is societally acceptable, I think you're relatively mentally healthy. Now, each society imposes its own kind of structures around these three benchmarks. Yeah, its own benchmarks, and that's where I think there is a disparity in what we define as mental health, as defined clinically by some DSM manuals versus, what is acceptable in society. So I think we need to delve deeper into the whole subject to truly understand, mental health, and it's related to, like you said, ultimately being happy with who you are, comfortable in your skin, being happy in your surroundings, and leading a purposeful life.
Yes, I guess that is a very good way of looking at it. But I think if Dr. Trisha was to go into it, she would probably think about genetics, brain chemistry, brain structure, and stuff like that. So that's where perhaps she was coming from. Anyhow, Dr. Trisha, how accessible are mental health services in India for people who might need those services?
Well, if you want to go by official figures, the official number of psychiatrists per 1 lakh population is 0.75. That's less than one psychiatrist for 1 lakh of the Indian population. There's about a handful of psychiatrists, and by a handful, I mean 9,000, with around 600 to 700 psychiatrists coming up every year, passing their MD exams. But of course, for a population like ours, what is 10,000, right? Compare that to clinical psychologists or counseling psychologists, and the number decreases even further. So clearly, there is a very, very wide gap between what someone may need in terms of their mental health and what actually is being provided for them.
So actually, when we talk about the disadvantaged groups, then they are more at a loss, perhaps, because here we are talking about normal, average groups, and even to those people, these services are not so easily available. So when we look at the entire societal fabric as such, how much of dissonance do you think is caused in this fabric, in the functioning efficacy of this fabric, by the issues of mental health?
Well, see, that is a difficult question to answer because we don't really know.
Okay, that's what I'm.
Mental health, whether these issues exist for people, whether they want to acknowledge the fact that they exist for them, that's the question you ask first. How much it then affects society and someone's functioning in society, that comes later. Right now, it's so covert in our country, and it is so unacknowledged that we will blame everything else, from the alignment of the stars to maybe like a bad breakfast in the morning, before coming to the topic of mental health. So this is a difficult question to answer.
Sabeer, you come from such a hygienic environment in the Silicon Valley. What is the state of mental health issues and management and diagnosis of these issues there?
I think first thing is mental health affects every society, and there's no such thing as one society is better off. There are people who are born with personality disorders in every society. I think the difference between what we see here in India and in the West is acceptance that there are people who need psychiatric intervention, and people don't feel that it is a social taboo to go to mental health specialists, to even get self-diagnosis on issues, and that's what makes it different, and over there nobody cares about what other people will think about you and how you deal with you and your doctor, and it's a very personal thing as well. That's why there are extreme privacy laws, regulations that keep the doctor-patient consultation extremely, extremely confidential. And as a result, a lot more people avail of these resources. They, even if they are functioning healthily, but they feel depressed at times, they go visit a doctor, a psychiatrist, to seek professional help. And as a result, I believe the society is better able to manage this issue, that it doesn't, impede the society in any way. I mean, or the appropriate decision making, for example, occurs, and that's why society moves forward, in a logical, progressive kind of fashion. Whereas I think if there are people with mental health issues and they are in positions of power, that can lead to a lot of wrong decisions being taken for the wrong reasons, and which cause harm to the whole society as a whole.
Right. Dr. Trisha, how long have you been, you must have been seeing patients now for quite a while. And I'm saying patients, people who identify themselves, their families do, you possibly do, that these people need, health care in the sense they need caring, they need medication, they need to be looked at seriously. A lot of these kind of people come to you, okay? So, how you deal with their, you probably deal a lot with their sense or their family's sense of social stigma, and you must probably try to get through to them and tell them, look, your struggles do not define you. This is a biochemical issue, or this is a chemical issue, or whatever, and this is treatable, and you all right, and it's okay to be okay. So you've come here to be okay. So that kind of what's your experience?
Um, well, I would like to correct you a little bit. I don't think it's entirely a biochemical issue. This is a fairly, it's a fairly outdated way to only think of mental health disorders as purely genetic or purely biological. Of course, the origins of certain mental disorders are more genetic or more neurobiological than others, such as, say, bipolar disorder or, say, schizophrenia, the more psychotic disorders, as we say. But certain things like depression and anxiety, they do have a very big psychosocial baggage attached to it as well. Right? So, I wouldn't go and tell them, I wouldn't purely medicalize it for them. Although that would be helpful in a country such as ours, I think in the long run, it defeats the purpose for which they're there, and second of all, of course, the first step is asking them to self-reflect, asking them to destigmatize these issues that they're facing within themselves, tending to the attendance, tending to the family members, tending to society comes later. If a patient, as you said, comes to me and their primary concern is, I have all of this, I'm suffering through all of this, I can't get up from bed or take a bath every day, I am so sad, nothing pleases me anymore. And I deal with it and I explain the diagnosis to them. I offer therapy, I offer medication. But the question at the end of the day from them is, okay, but when can I return to work? When can I earn? So what do you have to say to that? How do you explain or destigmatize what they're going through to them then? When their sole focus is productivity, you can't pull back from that, So all of this needs to be done not in one session, not at the first time, but over a couple of meetings when you get a sense of exactly how much they prioritize and what they prioritize in their life.
You mentioned along the way something called bipolar. Earlier, perhaps Sabeer might associate with this long time ago, we never used to talk about bipolarity. We didn't know what bipolarity is. If you the maximum you would say to somebody, oh, he's this, he's that, cuckoo or whatever. But now this term bipolarity is used, very, very effusively for anybody who has the slightest of disorder. What is bipolarity, and how many people do you think in our society, in percentages, are bipolar?
So bipolar disorder is, of course, a psychiatric disorder. It is a affective or mood related disorder, where someone, instead of remaining at a baseline of mood and emotion, where at some moments you might feel a little happy, at some moments you might feel a little sad, and you are able to effectively deal with these emotions, They experience highs and lows which become a little unmanageable and also become a little dysfunctional to them. They affect their working capacity, they affect their interpersonal relationships, and the poles that we're talking about. Mostly, although it extends on a spectrum, mostly what people are aware of and mostly what people come up with are two poles of mania and depression. Now, mania is the upward end of the spectrum where you have an increase in energy, over talkativeness, over familiarity, very, very jovial, very, very happy, spending a lot of money as if there's not a care in the world. That is, of course, mania. The other end of the spectrum is depression, which we all know of a little more, where you are low, you don't have any energy, you don't feel like talking to anyone, you don't want to buy anything because what is the point of life, you know? So between these two poles, for someone to exist and for someone to wait and watch with bated breath as to when they would slip into one pole or the other, that is the experience of someone who has bipolar disorder. If we talk about figures, I would say it extends to around 4 to 10% of the population.
Really?
Yes, it does. However, the official numbers are around 4%.
Then there are disorders that also emanate from lack of empathy.
Absolutely.
You know, when people just are born, and this is, I mean, I read a book by Dr. Dick Swab, which talks about we are our brains. And what he posits in that book is that all of our behaviors are actually can be traced back to the physical structure of our brain. So there are certain parts of the brain, if they are missing or they are vastly reduced, such people have no empathy. Now, if somebody has no empathy, you know, what guides that individual in life? Is it just laws, legal, or is it, you know, do they get extra pleasure out of giving grief to others, sometimes even going to the extent of mutilating other people, you know? So those are serious disorders that I think, obviously the doctor will shed light on it, but they can be traced back to deformed structures, physical structures in the brain.
Absolutely. So I think what you're talking about is a personality disorder called antisocial personality disorder, the specific examples that you mentioned, where there is a lack of empathy, there is a lack of remorse or regret. There is an inherent tendency to harm without fear of any consequences. So that does arise from, mainly it's the frontal lobe of our brain, which has a certain deficit in certain neurotransmitters that are supposed to function. There are certain genetic abnormalities also that are associated with antisocial personality disorder. So amongst the personality disorders, it does have a much greater genetic or biological basis than the others. Why I emphasized on personality disorders is because personality disorders are what we call a trait disorder. The rest of what we've just discussed, such as bipolar disorder, such as depression or anxiety, they are more state disorders. They occur and then they may go and then you might relapse. It's a cross-sectional diagnosis that you're making. A trait disorder, on the other hand, exists from the day you were born or at least from your early infancy. So that is something that you are born with it.
I see. So, I mean, when we talk about sort of anxiety disorders, mood disorders, personality disorders, and adjustment disorders. So, how of what import are adjustment disorders? Because this is a very mobile world now. That's one. And second is that we are suddenly bombarded by a lot of cross-cultural exposure. You know, if not by actually physically going out, but just on your device. So, how do we deal with you know these adjustment disorders?
By adjustment disorders, you mean anything brought on by your immediate environmental stressors, by something that is a product of outside,
Yes.
that is affecting you within, right? Which you are finding a difficulty to cope with. When we talk of adjustment disorders, we talk a lot about coping strategies and how coping strategies sometimes fail. At a certain point of time, some of it is pre-decided where we tend to cope with a certain situation in a certain way. Since the age of 12 or 13 or 14 years, since our personalities start to form, we tend to have a tendency to deal with problems in a certain way. When that starts failing for us because of the added burdens this world forces upon us, that is when you have an adjustment disorder.
So, my next question to you, Dr. Trisha, is that are there really effective strategies for mental health prevention? For example, there's something called preventive health care management. So, is there a preventive mental health care management? You can prevent heart disease by, in not doing certain things and doing certain things, and various other, ailments. Can you prevent, mental illness?
Well, the mind doesn't exist outside of the body. It does exist in conjunction with your body. So I think first and foremost, mental health care is a health care. Physical health care, if you're preventing physical deformities, physical ailments, then automatically mental health improves. If you live a healthy, active life, if you find moments for movement on your day-to-day basis, if you have a diet that affords you all the micronutrients and macronutrients that you might need, automatically it's better for your brain. And along with that, of course, I think the first step is creating an awareness about the fact that mental health disorders exist. You don't know what to prevent or what to look out for if you don't know what it is, if you don't know there's a name for it. So the more that there is awareness, the more that you know that, okay, the fatigue that I'm feeling might not just be jet lag or exhaustion, it might actually be depression. The more you do better to prevent it, the more you tailor make your own life to prevent those things. If you recognize your anxiety, supposing, then you know you don't have that cup of coffee in the morning because it gives you palpitations. But if you don't know, then you don't know and you don't do anything about it.
Well put. Yeah, I guess we understand that. But you cannot do anything preventive about bipolar disorders. You cannot, maybe you cannot do anything preventive about so many other, perhaps most mental disorders.
You can do something about it in the sense that there is a concept called bringing forward in time,
Okay.
where there is a tendency to have a certain disorder and certain things might make it happen for you in your life earlier than you might have it. You might have your first episode of mania at say 28, 29 years of age. But if there is a stressor, physical or mental stressor at say 14, 15 years of age, that's not to say that it doesn't happen at that moment in time. You've brought it forward in time. Now, if you prevent that particular stressor from happening, then it's very possible that that episode is pushed further on. Maybe you have it at 30. Maybe you've taken care of yourself so well and you know that you have a predisposition to this. So you do everything to control this disorder and you never have it at all. So it's more of a mystery in a certain, in this certain disorder. I get the sense that maybe if there's the advent of AI in mental health specifically, maybe for something else like cardiology or say neurology, where it's a fixed framework of disorders, it's a fixed framework of presentations, clinical presentations, maybe it would work better there. But for mental health, I think you need a human touch a lot more. We have patients coming to our clinic for therapy where they get derailed, they get actually very bothered by a change in the color of your curtain. So when we talk about it from that perspective, if you take away a human face, if you take away the human touch entirely, how much someone would be willing to open up and how much care they would receive and how much that would be manufactured empathy, that remains to be seen. But from a service provision perspective, AI would definitely help, especially in a country like ours, where we don't, I mean, most of the hospitals, they don't even have an electric health record system. So if you have a larger pool, a fixed data set, which you can kind of refer back to, that would be excellent. I'm all for that.
No, I actually agree with Dr. Trisha. I'm not saying that AI will ever replace human beings because of there is something subconscious that transpires when two human beings just are in physical proximity of each other. There is kind of an exchange of information,
Empathy, actually.
empathy, which can never be replaced. And how do you spot liars, for example, right? Doctors, very well-trained doctors can do that, but a bot will never be able to do that because the bot only responds to whatever you give it. Now, yeah, there are increasingly even visual AI-based systems that can read facial expressions, but still, I think there is no the empathetic touch, and like for example, all of this Chinese medicine and Ayurveda and stuff is people say that it is flourishing only because there is a human being who's there willing to listen to you and can empathetically respond to you. So I think a real doctor, and especially in the field of mental health, can never be replaced by, but to address a large section of the population that does not have access to affordable mental health, I think this is a great alternative.
So actually, as they say that the language of empathy is best transmitted through the human eye. And if the eye is missing, then that empathetic factor goes down. Now, what is this impact of social media on mental health?
Oh, that's a difficult question. Social media is a double edged sword. Social media has changed the lives of so many, especially post COVID, because of the sheer boom of information that you have out there. I mean, people come to me already self diagnosed, cutting my work by half because they saw an influencer, they saw an informational post telling them what they might have, and then that's why they come forward. And now they know it's okay to talk about it because of social media. But at the same time, social media is also a product meant for consumption. And the more consumers that you have, the more you depend on this product to validate you and your choices. So then it becomes a race for the most amount of likes. Then it becomes a question of how many views you have on the recent video. And more Gen Z and millennials, they seem to be falling prey to this very consumeristic way of approaching social media.
So now, then there is a treatment. There is a treatment line of treatment. There are innovations to that. What are the latest trends in all this now in terms of addressing mental health treatments?
I would say in the last 10 to 15 years, we've made leaps and bounds in the kind of treatment modalities we have to offer. Both somatic therapy, which is where something goes into your body, a pill, or psychotherapy. There are various new types of psychotherapeutic measures that you can apply. Compare this to, say, 50 years ago when the first 60 years ago when the first antidepressant was serendipitously discovered by giving medicines to TB patients, and suddenly you saw they were happier, more jocular. That's not what we do anymore. We have a little bit of tailor-made psychotherapeutic interventions. There are things like RTMS. There are things like TDCS, where you have magnetic current-based interventions, which you can apply on an OPD basis. It takes a half an hour and it targets the specific part of your brain that you think is causing these symptoms for you in day-to-day life.
Okay, so as we proceed, we see that there is a huge need now to show respect and acceptance of people who are, who are ailing with some disorders, even if it is a very minor disorder. Then advocating, in our communes about the importance of this issue. Also learning more about mental disorders in a very general manner, so we can help people cope with these issues, because we do not know where these people are. Somebody might be sitting next to us talking, who we know very well, but we have never known that that person actually suffers from a trifle mental disorder. So I think we need to be a little more empathetic about all this, and and essentially, learn how to handle stress. Tell people the importance of handling stress, relating to others, and making healthy choices is all about using the mind correctly, and so on and so forth. So thank you very much. I think we have a constraint of time here. It was lovely talking to you. And Sabeer, despite your technology background, I thought I'm almost talking to yet another psychiatrist here. But Thank you guys for this beautiful expose on mental health. I wish we could have carried on, and I do hope that we will return to this subject soon again. Thank you very much, Dr. Trisha, for your time and for participating here. Thank you,
Absolutely.
Sabeer.
Thank you very much.
Thank you for having
Thank
me.
you.
Thank you. God bless you. Thank you, sir.